the beginning of the 1800. Come on, we invite you for the frolics and 5 puffs free. So there was a poster. I can show you the picture. So that was the beginning of probably the so-called anesthesia. And one of such, during those frolics, one dentist named Horace Wells, he was attending that meeting, and during the celebrations he found that one person who had inhaled nitrous oxide got hurt in the shin and there was bleeding. But that fellow who got injured did not realize that he was hurt. So such a painful injury he never noticed. It struck him. He was a dentist. So he is not feeling the pain because of the nitrous oxide. Why not? We use the nitrous oxide for painless dental extraction. The very next day, he gave nitrous oxide to the patient and then pulled out the tooth, and it was a painless dental extraction. Then he practiced over about 20 or 30 patients. And then he wanted to prove that nitrous oxide can be used for surgical pain relief to the surgeons, doctors. The senior doctors in Massachusetts Hospital in America States. So they were with great difficulty, he assembled them in a meeting and then kept a patient for tooth extraction and he gave nitrous oxide. This happened in 1845. And by ill luck would have it because of the anxiety or this thing, probably he has not given the adequate nitrous oxide and the patient cried with pain. And these people, they are very great surgeons in those times. You have wasted our time, you are a humbug. So he became depressed and ultimately, the result is ultimately he committed suicide. That is a different part of it. Years later. In that meeting, there was one undergraduate medical student, W.T.G. Martin, William Thomas Green Martin. He was a medical student and he was doing in those days some researches with ether. So he found that ether produced unconscious, and he consulted his senior surgeon. And in those days there was no specialty, surgical specialty, medical specialty, no specialty. All doctors, if you want to practice surgery, you can practice. You know that our great Rotary was only MBBS, but he practiced surgery. So same way, in the 1800s, anybody can practice any branch of medicine. So he consulted his doctor, I want to test this ether, I will help you. And I want to test it during surgery. So he helped illegally or without the approval. He gave ether for surgical testing. He found it was effective. And after trying so many patients, he became confident that ether can be used for surgical pain relief. Again, he wanted to demonstrate in front of the surgeons. So surgical team must accept. Then only it can be publicized. So with great difficulty, again the same big people were gathered, the same such hospital in the operation theatre, now it is called Ether Dome. And it was on a Friday, 16th October 1846, exactly 1 year later. And he administered ether to the patient. And a patient with his name is Gilbert. His swelling in the neck was removed, and throughout the surgery he was without movement and he did not complain of pain. So it was a very successful demonstration. Everybody appreciated. Great surgeon. This discovery will travel throughout the world. That was the word that was uttered, and that elation. The W.T.G. Martin shouted, "Gentlemen, this is no humbug." Because he has attended the previous meeting where all the people called Horace Wells as humbug. He shouted, "Gentlemen, it is no humbug." This is a famous statement by W.T.G. Martin.